arrives on the scene, we put on BSI. Is the scene safe?
The scene is safe.
There's one patient. I'm applying pressure to the wound.
Assuming C-spine.
I'm going to cut. I'm going to disrobe the patient.
Breathing seems like it's shallow and irregular. Very little chest rise and fall. So
I'm going to put a gauze wrapping with water. Control the bleeding. Bleeding is controlled.
put a 4-sided bandage on it.
4-sided bandage applied.
I'm going to put in an OPA to keep airway management.
Measure OPA.
Measuring OPA, putting in the OPA, and I'm going to use positive pressure ventilation with high flow oxygen using a BVM. So, yeah. Watch the oxygen, please. And thank you. And ventilating once every 5 seconds.
I'm going to check carotid and radial pulse. There's a carotid and a radial. I'm going to continue to disrobe the patient. Going to I'm going to assess the head and pupils. Going to look at the neck. There's fluid coming from the ear. I'm going to assess the chest. 1, 2, 3, 4, 5. Let's go to chest. Look at the abdomen. 1, 2, 3. Assess the legs. Pelvis. 1, 2, 1. Assess the legs. 1, 2, 3, 4. There's no PMS. 1, 2, 3, 4. No PMS. Assess the arms. 1, 2, 3. No PMS. 1, 2, 3. No PMS. Going to put on C-collar.
Putting on the C-collar. Alright. And now we're going to log roll him. Arms.
Alright. On your count.
1, 2, 3. And check the back. And the back of the head looks good.
I found some bleeding back here. I'm going to apply pressure and stop the bleeding.
And my count, 1, 2, 3. There we go.
Alright.
1, 2, 3. There we go.
Alright.
And he needs to slide down just a little bit. 1, 2, 3. There we go. And come over here and put on these straps. Here. Go. 1 and 2. And okay, releasing C-spine.
Alright.
Strap him down.
We're going to do nipples, navel, knees, noggin.
And we are now transporting the patient. Okay, we're in the ambulance, putting on the non-rebreather mask with high flow oxygen. And checking vitals, blood pressure first. Blood pressure is 70/30. And you're going to check the heart rate. And heart rate is 50 beats per minute, so it's low. We have oxygen. And respiratory rate, it's about 4 to 6 breaths.
Hard left.
so we're going to do another assessment, secondary assessment. So looking at the face, there seems to be large bruising on the side, a little bit of fluid coming out of the ears. Head seems to be in place and good. Neck looks good, no serious JVD. Checking the chest, 1, 2, 3, 4, 5. Chest is good. Palpating the abdomen, looks good. No more bruising. 1, 2, 3. Okay, everything's dressing seems to be holding up. Checking the pelvis, push in, down, looks good. Check the legs. 1, 2, 3, 4. Still no pulse down there. 1, 2, 3, 4. Still no pulse. PMS. And checking the arms. 1, 2, 3, 4. Still no radial pulse. 1, 2, 3, 4. Still no radial pulse. PMS there. And checking vitals again.
This is EMT Sandridge. I am transporting a 17-year-old male patient with abdominal evisceration to the small intestine and minor head trauma. He also shows signs of kidney trauma. He has a BP of 70/30, a respiratory rate of 4 to 6 with high flow oxygen, a heart rate of 50 BPM, and an SpO2 level of 96%. We stopped the bleeding and applied wet dressing to the abdomen. The patient is on oxygen. We should be arriving at the hospital in the next 5 minutes.